and welcome to Public Health Uncoded with Dr. Saroj Pachauri, brought to you by Center for Human Progress in partnership with the POP movement, where POP stands for Protect Our Planet. Just as curious as you are, we are here with our latest episode of Public Health Uncoded with Dr. Saroj Pachauri. Climate change is likely to affect every area of our lives, like the toddler with sticky fingers. So today we have our guest answering some questions about climate change that should be taken seriously. My name is Drishya Pathak, and today we are going to talk about the impact of climate crisis on human health. We are going to talk about some environmental concerns. We are going to talk about the health problems we are already facing due to climate change. We are going to talk about how burning of fossil fuels causing concern for the land and the atmosphere. Also about some of the efforts that have been made to minimize this problem. I'm a vegetarian, and I know there is one universal topic that is part of usual discussions among the groups while discussing the issue of climate change. How much meat can you afford to consume? Do not worry, we have some points to discuss today, and I'm so glad that we have an expert with us who is going to talk about all the things. We have Dr. Antonio Galan with Dr. Saroj Pachauri. Dr. Antonio is a member of the Instituto de Matemáticas at the Universidad Nacional México since 1999. Prior to his current appointment, he worked at the Instituto de Astronomía at Mexico for 18 years with a physics degree and a PhD in applied mathematics from the University of London. Dr. Antonio has been interested in regional impacts of global warming since 2005 and offers a lecture course on anthropogenic global warming at the Universidad Nacional Autónoma de Mexico for both undergraduates and graduate students. Wow. Thank you for joining us today, Dr. Antonio and Dr. Pachauri.
Hello, Antonio. Welcome to this podcast. I feel very honored that you have agreed to participate in this podcast and to provide the audience with the wealth of information that you have acquired over a lifetime. In fact, this is very, very nice that you have joined us. And I would just like to say that climate change is on the mind of everybody these days. So the problem that we are going to discuss, which is health and climate change, is of immense interest to our audience. Now, we know that climate change is one of the greatest challenges of the 21st century, and that it does have serious adverse effects on human health. Extreme climate change events increase mortality and morbidity. They increase the prevalence of water and vector-borne diseases, malnutrition, and respiratory diseases. Climate change has serious effects also on mental health. And in fact, mental health is impacted both directly and indirectly, resulting in mental illnesses and suicidal mortality. Now, there are so many problems that health-related in this because of the impact of climate change, and these problems are growing and additional ones are being added. Would you be so kind as to talk about the health problems that we are already facing, please?
Yes, thank you very much, Saroj, and I appreciate the attention of the audience for these problems because they are really important. The main problems we're already facing, we're already suffering, is since global warming increases droughts and floods, this increase is in both frequency and strength of these two phenomena, that these floods become stronger and much more frequent depending on the orography of the sun, for example, depending on how the surface of the earth behaves. And that causes the presence of floods, for example, that human kidney problems or gut infections are becoming so numerous and severe that hospitals are already having problems. Hospitals and clinics are already having problems because they had become insufficient to treat all these cases. And then this is also creating a new kind of health problem, which is what technically is known as climate anxiety. That is, mainly children become very anxious, even though they are not familiar with the term of anxiety. They become so, and that is creating a very strong mental imbalance that has become a major psychological problem, mainly for children, but it also affects many adults.
Thank you. That's very helpful. Another problem that we are facing is that of burning fossil fuels. And even though we know that it's a problem, that this is not a good idea, and the problems are known, yet many countries, especially developing countries, are continue to burning fossil fuels. And this is causing many problems, including air pollution, in which there is a suspension of particles which are about the size of microns, and which the World Health Organization believes is the cause of several million preventable deaths every year. Could you tell us something about this problem and what else we should be aware of?
Yes, of course. This is, let's say, the second problem caused by burning fuels, fossil fuels. The first one is the increasing temperature, the famous greenhouse effect that increases the temperature of the whole Earth system. But the second one is the creation of this pollution. This pollution, as you already mentioned, is very small. It's what is technically known as fine suspended particles which are the size of have an average size in the range of microns. And this contamination, we cannot see it and we cannot detect it, but we feel, and our organisms are victims of all this pollution, mainly from what we breathe in polluted areas. This problem risks these health problems are for all forms of life on Earth, but this pollution also affects soil and water in such a way that soil is become infertile and water to become poisonous. That is decreasing the amount of oxygen, both dissolved in water and present in the atmosphere. As I was already telling you, the one which is contaminated, the atmosphere, we cannot see it, we just breathe it without knowing that we're in these areas, which are very polluted, and then we feel all their effects a little later on. The main problems are with lung problems, respiration problems, and also our eyes become very red, and that's because of this additional pollution. The World Health Organization estimates this pollution to be the cause of several millions of premature deaths every year. That is, people who live in areas which are very close to industries or which don't have any means to clean the air they are breathing.
Well, another problem that we are facing is that we are, misusing water and land, and we are taking up the land area that was previously being occupied by animals. As a result of that, humans are exposed to zoonotic diseases. And one disease that we have all just suffered is SARS-CoV-2, the pandemic that is still ongoing actually, and it's seriously affected the world, is an example of that. Now, this can happen again. We can have many more pandemics, for which we need to be prepared. Can you tell us more about what the economic system is doing to drive these risks, please?
Yes, of course. I think it's mainly a problem of created by the way we live. Surface and underground water are not only becoming very scarce, their amounts are decreasing very quickly, and that is a consequence of higher temperatures and the filtration, every second less filtration of water into the aquifers. This is becoming, this water is becoming poisonous due to the way that we produce clothes, machinery, and the way we cultivate food. This practice of consumerism, which is the technical name for this, let's say, way we live in, which is consuming things that we don't need, floods our lives with things that nobody needs, things which are even programmed to function during a very small time lapse, and also the inconceivable amount of food that gets lost even before it arrives to their selling points. So this is reducing available resources and mainly arable land, which in turn cause deforestation, ecosystems loss, and other health risks for life. It's what is technically known as an ecocide. That means killing the atmosphere, killing the soil, killing everything, killing all the environment around us in which we live. And as you have already mentioned, this is causing that we're invading areas that were occupied before by wildlife, by wild species. And so we become more frequently exposed to the interchange of many things with these species. They have bacteria, microbes, viruses, many things which are completely alien to human life. And so we get every time much more exposed to being, to acquire the diseases they have already had for many years, and they have developed the defenses needed for these diseases, but we don't have them. So we get much more exposed to diseases which are practically unknown to us.
Thank you. Apparently, climate change is affecting every aspect of human life, including how we are growing food. How is growing food exacerbating the health risks?
Yes, well, the problem is that we use industrial techniques to produce food. That means the use of a huge extensions, huge surfaces for the production of food. And we grow this food using agrochemicals and forever plastics. Agrochemicals and forever plastics both also come from petrochemistry. That is the chemistry of oil, and these things that we have mentioned, like agrochemicals and forever plastics, become very, very cheap because they started being produced with the remainings of the refinery of oil. And nowadays it is the other way around. The first instance for oil exploitation is the creation of agrochemicals and these forever plastics. We call them forever plastics because they last for centuries or maybe more time. And so they pollute everything for a big time lapse and are terrible. In many sense, we have already having lots of problems in the oceans with all these huge islands of floating plastics. And the main problem is that these plastics are also becoming so tiny because they start degrading their sizes, becoming much more smaller. And so they become also another source of pollution in the air that we start breathing without knowing that we are doing so. This ingestion of tiny particles, tiny plastics, becomes a very strong trouble for human health and also for many other species on the atmosphere, on Earth. And this pollution make soil infertile, and also the runoffs of this pollution cause a strong problem, which is called eutrophication of water in land and oceans. That is, this is the technical term, eutrophication, for the disappearance of dissolved oxygen in water, and consequently the surging of dead zones where previously oxygen, dissolved oxygen was very abundant in these areas. These dead zones, which lack dissolved oxygen, last for centuries or even more. So we are creating, let's say, cemeteries for life in the oceans, and that, of course, affects all the food chain, because food from certain land regions, which is very polluted by these agrochemicals, or ocean coasts, where we get lots of food also, are becoming the source of additional health problems, additional health risks to all forms of life, not only to humans. So this is a very worrying and very terrible problem that is increasing in time, and nobody does anything to stop all this industrial way of producing food. So that is also a consequence of the economic system that we mostly follow in the rich countries.
This is a very serious matter because food is being ingested by all of us and by animals and others. Has anything been done about this? Have some efforts been made to minimize this problem, sir?
Well, it's a very complex problem, and it means that the United Nations organization is already asking people to change their eating habits, because even eating too much meat, let's say, means a huge problem for all the environment. I mean, growing meat, growing the cattle that becomes meat for you at the supermarket, let's say, is not a free task. It involves lots of other activities that create a huge pollution and also consume lots of water. We can live very happily without this consumption of meat, especially in some countries in which they consume huge amounts of meat. But we cannot live without the water. And that water that we need to live is being consumed, is being used for the production of this meat, which becomes so expensive because of the amount of water that is involved in its production, and also the things they use to produce the meat, that most of the population in the world is not able to pay for that high prices. So many of the population, and that's something that probably the United Nations has not considered in detail, is the fact that many members of the world population are already or have never eaten meat because they have never had the incomes to pay for this very high and very expensive ingredient of some of the diets of the Western world. So this needs to change, and we have to follow a very different way of feeding all of ourselves. And well, fortunately, you come from a country, from a culture that where the consumption of meat is very, very low or completely absent in some of these places. But we need to, and you have a very beautiful food, very tasty, and I like it very much. So we should show the rest of the world that you don't need these huge amounts of meat and other things like meat, that you can be as healthy, as well nutrified, and to acquire everything you need for your healthy life without consuming any meat, especially in those amounts that they are used to in the Western world.
Well, eating meat also results in other problems. You know, there are overeating, over consumption of meat and other such products can result in obesity, non-communicable diseases, which are now increasing globally, including in my country, where there was a lot of vegetarianism, as you said, in India. However, people are eating more and more meat, unfortunately, and eating fast foods very much more. So I think it's getting worse, actually, everywhere. And there's a need to change dietary habits and to change physical activity habits as well. More physical activity is needed. The numbers of cases of non-communicable diseases is astounding now in the developing countries. Of course, it's always been in the developed world, but it is now extending into the developing countries that are bearing the double burden of communicable and non-communicable diseases.
Exactly. Well, one of the previous pandemics, let's say, which was not really a pandemic, but it was very strong in Central Europe, was what we got to know as the crazy cows problem. That was a kind of encephalopathy from meat that was producing, which later became known as I just forgot the word for once it became part of the human diseases, the name changed from crazy cows to, I don't remember the name. And that was one of the main examples that we had about 40 years ago. It was very strong, and we didn't learn anything from it. Because then if we had done so and we had been prepared, from then we would have stopped invading all these pieces of land where wildlife lives, and so it became a much stronger problem. Where in the countries in Europe where they were used to eat lots of meat, they had to sacrifice many animals that were artificially grown to satisfy that demand for meat, and they had to lower their consumption, to slow a little bit their habits, but it was just for at most a year or something like that, probably not even a year. And then they started, once the industry of meat in Europe became normal again, they started growing as if nothing had happened. And they started eating much more meat, and they increased the problem much more severely. Fortunately, we have not had any more contamination from cows' diseases, but I wouldn't be surprised if in the next couple of years or before the end of this decade, if we get much more infections or diseases from wild animals. Even these were not wild animals. These were already domesticated animals that we human beings were creating, were growing, were sacrificing just for their pleasure. So that's also something that we should consider much more carefully. We know we're not the only species on Earth. So where does it come the right to live the way we live? It is senseless. We need to consider much more carefully how we treat animals, and just from the point of view of determining the amount of these animals, these animal resources that we can use for special treatments for some special human beings, but not for all, and not in these huge quantities. It is calculated that 10,000 years ago, about 95% of animals were free animals, and only 5% were human beings, and the animals that they had started to grow up for their benefit, to domesticate for their control and eating them. And now it's completely the other way around. It's 95% of the inhabitants of this earth, human beings, and the huge amounts of animals that we use for our consumption. And it's only 3 or 4% of these animals, which are free animals, how they used to be 10,000 years ago, which is just a blink in time, considering the presence of human beings on the surface of Earth.
Thank you very much for reminding us about the mad cow disease, which affected at that time seriously and which we have forgotten about now. Thank you also, Antonio, for all your inputs. This has been a wonderful discussion. You are very generous with your sharing your thoughts, and I know that you have been very generous in providing chapters for the book that Ash Pachauri and I are writing on health and climate change, which is presently in the process of being written. Thank you for contributing to the book, and thank you very much for sharing your thoughts today at this podcast. Thank you.
Thank you, Saroj.
That's a lot to unpack. Climate change seems like a big, distant issue, but you have really brought home how it is impacting our health right here, right now. From the increased spread of waterborne diseases and malnutrition to respiratory problems and even mental health issues, the effects are wide ranging. I'm sure you also got the answer to the question how the UN's recommendation to reduce meat consumption makes perfect sense. And it is time to move away from meat heavy diets and embrace healthier food habits. Also, I think it is clear how our dependence on fossil fuels is a major culprit, not just for climate change, but for air pollution that is causing respiratory problems and premature deaths now. And disturbing ecosystem through land and water misuse opens the door to new diseases. You also highlighted the role of our economic system driven by consumerism and excessive resource use, industrial food production with its reliance on agrochemicals and plastics is another big piece of the puzzle, contributing to pollution that harms our health and devastates our oceans. This has been a powerful conversation. Dr. Antonio and Dr. Pachauri, thank you for helping us understand the critical link between climate change and public health. And my dear listeners, remember, individual choices can make a difference. There are many things we can do in our daily lives to reduce our impact on the environment and improve our health. We will be exploring some of those options in the future episodes as well. So stay tuned and see you in the next episode.